Okay, so we are going to talk today about patient flow, bringing a patient back for a surgical procedure. We're going to talk about it in context of anesthesia so that we can get the protocol down and the process down for how to set a room up. So let's walk into the room. Let's say I have a patient with me. The first thing I'm going to do is bring the patient and seat them in a chair. We confirm with the patient what we're doing. We confirm that the patient has not had anything to eat or drink for the 8-hour time that we talked to them about beforehand, that they have someone with them that can take them home afterwards and keep an eye on them during the day. When we've confirmed that we're doing the procedure and that we're going to do it with sedation, then we get the patient hooked up to the monitors. One of the reasons why this is important is because we're working to find out if there's anything that might stop the procedure from moving forward. So we turn the monitor on. This is before we've obtained consent, basically, but we've confirmed and we ask them, can I hook you up to the monitor? We're going to take some vitals and then we're going to get consent. So start with the blood pressure cuff. You can proceed with the leads for the EKG, put the pulse oximeter on, and we can leave the nasal cannula off until a little bit later on. But those are important. We want to get a blood pressure so that we can see that it's appropriate for the procedure, that's not going to stop our procedure from moving forward. Once we have the monitor on and we've seen the vitals and they seem to be appropriate, then we can move on to the consent form. I want to make note of a few things that are set up in the room before this point, before the patient even comes in, to get ready for the procedure. So we're going to look down here on the counter. We have emergency instruments and materials to help us in the case of an emergency. We have emergency airways in the form of a laryngeal mask airway. We have endotracheal tubes. We have these little forceps called McGill forceps. We have a nasopharyngeal airway. And there should also be an oropharyngeal airway. And we have this called a Yankauer suction tip. So all of that should be set up before the patient comes in. Also importantly, we have this instrument here, which lights up. It's good to check and make sure that the batteries are still working when we set up the room. So we have everything here set up for an emergency airway should that ever be needed. When we set up any surgical patient, if we're doing any extraction, I prefer that we have a surgical handpiece ready to go. Even if it looks like it's going to be a routine extraction, it is always a good idea to have the handpiece ready in the case that we need it. That means we have the handpiece and we can take the handpiece out of the sterilization pouch, connect it, and then cover it with the pouch again so that it remains clean. That can be set aside. And one thing that often gets missed is to make sure, one, that we have irrigation and that the irrigation is unclipped and ready to go. So this clip right here often gets clipped after a procedure. We want to make sure that that is unclipped and ready to go before the procedure goes. We want to make sure that the unit is plugged in, and we want to make sure that the pedal is moved to the ground so that nobody has to remove gloves, touch the pedal, wash hands again, all of that stuff before proceeding to the procedure. Those little things help to make the procedure flow a little bit easier. Which brings me to another point. One thing that I forgot to mention, when we have the patient hooked up to the anesthesia monitor and we've taken a blood pressure, the machine will automatically start to print out the vitals. At the beginning of the procedure, before we start, we want to press the record button here. This button, when it's pressed, will print out on that paper their current heart rhythm, and that's important to have for documentation. Okay, so let's go back over to this direction. We've talked about airways, we've talked about the handpiece, how to set that up, and then we want to look back here on the back counter where we have our intravenous setup. So we have a flush, we have a IV connector. When we set up a room and we prepare for an IV, we want to take the flush, open that up, and we want to take the lid off, connect it to this connector. Once this is connected, we can take the blue protector out of this connector and we can set that whole unit down here. That will mean it is ready to be placed. We have the 22 gauge needle ready to go, and we have a tourniquet ready for IV placement. We should also have an alcohol swab ready to go so that we are ready to place when that time comes. In the basic setup here, we have a surgical aspiration hose, and it should have a surgical suction with it as well. That should be ready to roll. We have our basic surgical kit, which contains most of the basic instruments that we have and that we need for an extraction. Outside of that kit, we should also have a sweetheart retractor. And we should have 4x4s set up and ready to go for the case as well. That's every surgical case. We should also have irrigation on hand for every surgical case. So we need to have at least 1 or 2 syringes, depending on how many teeth we're doing. If we're doing multiple, it requires more. We should also have a 15 blade and suture. Those are the basics that may often get forgotten, but we need to make sure that those are on hand so that we don't take breaks during the case to step out of the room to get those things, and adds quite a bit of time to a procedure.